Good morning, everyone. Welcome to day 17 of our Vine Health updates on the COVID-19 pandemic. The whole idea of Vine Health is to keep you informed, give you facts from the previous 24 hours, and to give you tips on living healthy and thriving during this time of isolation and staying indoors. Now, this morning I'm going to talk about diabetes and coronavirus, and this is because somebody sent a question and about diabetes and what to do at this time. So I'll talk about that towards the end of this morning's update. But I will go straight into giving you updates from yesterday. It's still, the news is still very, very unusual, and this is unprecedented times. So if I talk about Nigeria, the cases haven't gone up that much. I think it's now about 139, but the lockdown started on, I think it was Monday night. But it's unfortunate because Nigeria is not geared to this sort of situations. Our economy, our system is very weak. So people are already beginning to cry out in pain and suffering. This is because there is no basic amenities, no light. They're not able to preserve food that have been bought. There's no social welfare. So some people who can't go to work cannot earn any money. And if we are not sorting it out quickly, it's not going to be very good. So I hope it's just the 2 weeks of isolation, and hopefully the cases don't go any higher, and everything sort of remains quiet for Nigeria. I mean, so far there's been only 2 deaths. So if everything remains this way, hopefully everything can go back to normal in 2 weeks, because the country is not geared up for this sort of difficulty. The health system is not geared up for this. The social system is not geared up for this. The economy. And it's very disappointing. I'm Nigerian. I'm a proud Nigerian, and I want to see my country thrive. I want to be able to sort of just be involved with everything in the country. So I'm just, if anybody sees this and you're in government in Nigeria, correct me if I'm wrong, but there's no electricity in many areas. There's no power. They're inside the house. They're not able to have any sort of distraction. What is going on? Can you just let us know what is going on? And some people are even saying they'd rather go outside than be inside in the suffering. Anyway, enough of my venting about that, but I feel for whoever is going through that, because I have gone through that situation where there's no electricity and you're sweating, you're stuck in there. It's awful. So the government needs to do something urgently, not just for now, but for the future. And now moving on to the UK, the death rates, and yesterday when I did this update, I was like, oh well, the more people died, but was not as much as the day before. So maybe we're seeing a plateauing. But actually yesterday, the death went up to 1,800. So there was an extra 393 or so people that died. However, they've added the people who are dying in the community, who are dying at home of suspected coronavirus infection. So they're beginning to add those numbers now, because people are beginning to die at home as well. So for anybody who's affected by this, I am so sorry, and I hope that you pull through it if you get a coronavirus infection. And many people have already had it and they're not aware. But if you have a dry, persistent cough or a fever that lasts for up to 10 days, you most likely have had it. Or you may have had it and not expressed any symptoms at all. It just varies from person to person. The United States, again, same thing, not good news. You all know what's going on. And I don't think we need to flood our ears with negativity. We know what's going on, but I know that many states are tackling it by really asking for ventilators, trying to get all of these things that they need for their staff and for personal protective equipment as well. So good luck to everyone who's dealing with it. Everyone across the world is dealing with it, and 80% of the United States is now being asked to social distance and lock down essentially. again, all the trials and science is all going on, rushing to try and get a solution for this. And if you don't understand the reason for the lockdown, this is the reason for the lockdown: is to keep the virus suppressed, keep everybody inside, so that we're not having more and more cases going into hospital. That gives people time to find a solution to the problem as well. Because when we all come out again, there will still be some of that in the community, and there will still be a little spike. There might be a little spike again. So that's what's been going on since yesterday. There's a whole lot more different things, but I mean, I can't fill you in with everything, but there's been a lot of innovation as well. So respirators that are small have been developed in the United Kingdom. Just different things are going on. Fashion houses are making face masks. Now, people are just being innovative. So if you're at home and you have a talent, please do it. This is the time to get in there. Maybe make some face masks, or if you can make some personal protective equipment. We are desperate for it. We don't have enough, so we're desperate for it. And that's that. Now, if I'm going to go on to the question and answers session, and I think there was a couple of questions, but I'll just take them in little bits. But before I go into the questions, I was just going to say that remember that as Black people, particularly if you're brown or dark skinned and you're inside, your vitamin D will be getting lower and lower, and then you start to have symptoms and that might be related to vitamin D deficiency. So send a message, buy some vitamin D from Vine Health. If you're in the UK, we can send it to you. At the moment, we can't ship outside the country, but Vine Health does its own special vitamin D supplement, and at the moment we've got some ones are 1,000 units and then 3,000 units. We don't have the 5,000 units, but the 3,000 units are in stock. So I'll suggest that you get some of that and just take it every day so that you don't have vitamin D deficiency. You know that if you're vitamin D deficient, there's a myriad of symptoms that you would have, including extreme fatigue, pain, generalized aches and pains, feeling depressed. It can worsen your cardiac problems. It can worsen your allergies. There's so many symptoms from vitamin D deficiency. Okay, so enough of the plug. To go on to the question and answer session, I think I answered this particular question already on the comment box, which said that, is it true that people with A blood group are at high risk of contacting coronavirus? Again, the evidence is very, very weak. I mean, this was based on a small observational, a small study in China, where they looked at about 2,000 patients who were admitted for COVID-19, and then found that a slightly higher percentage of them with the A blood group had the virus, as opposed to those with O blood group, and the O blood group were thought to be the ones that had the least chance of contacting or sort of being ill with the virus. But again, as I say, this is not grade A science, it's not grade A evidence. It was based on one small study, so it doesn't hold up in any scientific avenue. So don't bother looking at that. The main thing is just to keep yourself indoors, stay safe, and just not interact with anyone apart from your immediate family, unless you absolutely have to, if you are a key worker. And again, doctors, nurses, admin staff, reception, anyone who's involved in that, just keep yourself safe as much as you can. There's also the question about the aerosol. I think I've answered that question as well, about this being able, that the coronavirus is able to stand in the air and get infected. The evidence is weak. Please, that means you won't go outside. Don't worry about it. The main thing is that you don't get close to anyone. Give yourself at least, I give people a very wide berth when I'm talking to them, at least 3 meters, not even 2 meters, so that they don't sneeze in my face or spit in my face when they're talking. Fantastic. Okay, finally, the last question, which is what informed my topic for today, which was sent and says, I have diabetes. Is there anything I can do to guide against this coronavirus? I mean, with diabetes, the main thing is to keep your condition stable and follow all the guidelines that have been given to everybody else. So you don't have to take any special precaution unless the diabetes that you have is possibly due to another problem, which is like more severe. So for instance, people that have cystic fibrosis causing their diabetes, they would need to be shielded and not go anywhere or interact with anyone. But if it's a straightforward type 2 diabetes, which is the most common form of diabetes, then what everybody's doing now is sufficient. The only risk is that the diabetes can get worse if you are not looking after it and you're sedentary, so you're sitting down all the time. But you don't have to do anything extra to guide against it. Just stay indoors, don't interact with anyone. Because again, if you then do get coronavirus and you already have diabetes, then the complications may be worse for you. So it's best not to get the coronavirus. But then again, it could be worse for anyone. We don't know. So if you have diabetes, what are the things you need to do? Many diabetics check their blood sugar at home. So if you check your blood sugar at home, then you know what level it is and you can manage that. If you don't, then you need to be extra vigilant for the signs and symptoms of either a hypoglycemia, which is a very low blood sugar, or a hyperglycemia, which is a very high blood sugar. So you have to be very sensitive to that and take care that you don't get into that sort of situation. You should also check your blood pressure as well, because we know that if you have diabetes, you can then get high blood pressure and vice versa. So just keep your diabetes in check. In the United Kingdom, you're not able to have your regular health checks at this point. But, when all of this is over, then you can go back and have your regular health checks again. But the main thing is that if you have any symptoms that are unusual, you need to speak to your doctor. If you're taking medication for your diabetes, be very, very, very careful as well. Because if you're not eating right, or you're eating too much, then you have the risk of hypoglycemia, and both of these things can be fatal. So if your blood sugar is too high or it's too low, they can be fatal. Keep an eye out, because it might be an increased risk of infections like thrush, like foot infections, like wounds that don't heal. So as a diabetic, you have to be really, really, really careful. Make sure you don't run out of your medicines. Make sure you're drinking lots of water. It is even more important for you that you're drinking regularly. Stay away from fizzy drinks and really things high in sugar, unless you feel like you have hypoglycemia and you're feeling dizzy. Then you need to have something high at that time. You can't go to your doctors, as you know, so you need to have a phone call if you're concerned. Call and speak to somebody. The doctor, we are always there to speak to you at any time. We just won't bring you in. So that's the question about diabetes and coronavirus. And that's a summary for today. I would appreciate everyone who's taking their time to either log in or watch it later or share it or click like on Vine Health. I've got so many more friends now than before, but I will still only have 200 likes. So I have, if all my 1,500 friends click like on Vine Health, I think that would make a big difference. So please go ahead to Vine Health page and just click like as well. I'll be back again tomorrow to share more tips. If there's anything you want to hear, let me know. Send me a message. Again, I sent also a WhatsApp number that you can send your questions to as well. So I look forward to seeing you tomorrow, everyone. And take care and have a great day. Stay safe, stay home, stay strong.